Hello and welcome back to my YouTube channel. So today I'll be answering one of the questions that I've gotten so far, and it is on oral thrush. Now, many people out there are experiencing oral thrush, and it has become a point of concern for them because there are no other symptoms. I mean, they are not experiencing fever, there's no headache, no pain in the body. There's nothing that could be pointing to the fact that they have an underlying medical condition or not. But then here they are having a cold on their tongue and they are wondering why, what happened. Don't worry, if you are one of these people, I am here to answer your question. Today, I will be telling you the meaning of oral thrush, the causes, the diagnosis, the treatment, and of course, how to prevent it from happening to you. Now, if that sounds like something you would want to get to know about, kindly watch this video to the very end. So without further ado, let's dive into the video of today. First things first, what is oral thrush? Oral thrush, also known as oral candidiasis, is a fungal infection that happens when there's an overgrowth of Candida albicans. Now, I need you to understand that this fungus naturally lives in our body, but certain conditions cause it to multiply and lead to infection. Now, what are the causes of the overgrowth of this fungus? Number one is immunosuppression. That's when the immune system is weak. You can also call it a weakened immune system, and this could be in two parts. It could be a local immunosuppression, and it could be a systemic immunosuppression. A local immunosuppression is when it happens within the mouth alone, like all other parts of the body is not affected, the systems are not affected, the organs are not affected, just the mouth. And this happens the people that experience this are, for example, the asthmatic patients that takes corticosteroid inhalers, right? After taking these inhalers, the corticosteroid has a way of affecting, of multiplying the fungus in your mouth. This is why it is advisable that after using your inhaler as an asthmatic patient, you should rinse your mouth to wash away the residues of corticosteroids that might be sitting in your mouth or on the surface of your tongue. Moving on to the systemic immunosuppression, this is when the immune system itself has been affected, when the immune system is weak already and can't fight against the diseases that might want to gain ground or creep into the body. For example, the AIDS patients are most likely to have a systemic immunosuppression, because it affects the immune system, it weakens the immune system, and the moment the immune system is weak already, it wouldn't be able to fight against the sicknesses that may want to creep into the body and gain grounds. And if the immune system can't fight against these diseases, these infections, they would creep into the body successfully and gain grounds. Now, let's talk about another cause of oral thrush. That's extremes of age. I mean, the very young people and the very old people. The very young people are still developing their immune system. I mean, their immune system is still under development, right? This means that there's a limit to what their immune system can fight against. And this makes them susceptible to oral thrush, like they can have oral thrush easily. Likewise, the very old people, every part of their body is getting weakened already, and that's why we call them old, because every part of their body, their eyes, their nose, their nervous system, their immune system, circulate, everything is getting old, and this means that even their immune system is getting weakened already. So this set of people are prone to having oral thrush as well. Another cause for oral thrush is poor oral hygiene. This is a topic that I have always hammered on, have always spoken about this topic, and I will continue to speak about it. When you have poor oral hygiene, then your mouth is susceptible to oral thrush, and there's absolutely nothing you can do about it until you level up your oral hygiene game. Another cause for oral thrush is the use of denture. Denture is an artificial tooth or teeth. For those who make use of denture, there's every tendency that they have oral thrush, because this fungal would most likely stick to those dentures, and if those dentures are not properly cleansed, then it can just be an anchor. It can be an anchor for this candida albicans. Now let's move on to the common signs of oral thrush. Number one is white creamy patches on your tongue, your inner cheeks, on your throat. Number two, redness or soreness in the mouth. Number three is loss of taste. When something is sitting on the surface of your tongue, you won't be able to perceive the taste of whatever you are taking, because your tongue is meant for taste. So when there is a coat on the surface of your tongue, of course, you will lose your sense of, not that you lose your sense of taste, but you won't be able to, you won't be able to taste well, right? Now, the fourth sign of oral thrush is a burning or pain when eating. You begin to feel a burning sensation, or you feel pain whenever you are eating. The last on my list is cracks at the corners of your mouth. It is also called angular cheilitis. Yeah. So I will be putting the picture on the screen. You'll be seeing the picture right now on the screen. That's angular cheilitis, and that's exactly how it looks like. When you have this, when you are experiencing this, you might as well want to check if you are having oral thrush or not. Now let's move on to diagnosis. The major diagnosis for oral thrush is clinical diagnosis, and this clinical diagnosis is, the dentist or whoever, the medical practitioner you are seeing would ask for history. If you have anybody who has experienced this in your family, or you have experienced this before, the person will check for signs in your mouth, the white patches, the sore, the pain, the redness, the soreness in your mouth. They will check for all those. So those are the major things that will be checked for, that would make the health practitioner to diagnose you for oral thrush, or to know whether it is something else entirely. Moving on to the treatment for oral thrush. The major treatment for oral thrush is antifungal medications like statin or fluconazole. Disclaimer, please. Disclaimer. This video is not a substitute for visiting the hospital. I repeat, this video is not a substitute for visiting the hospital. With that being said, let's continue. Like I said, the major treatment for oral thrush is the usage of antifungal medications like statin or fluconazole. I need you to also understand that this infection can be transmitted. This is for those of you who can kiss anyone, like you love to kiss. I'm not saying you shouldn't kiss, but then just know and have at the back of your mind that if the person you are kissing has oral thrush, then you will most likely contact it, right? Because oral thrush can be transmitted. Now let's move on to the prevention of oral thrush. Number one is good oral hygiene. Make sure that you are practicing a good oral hygiene, have an oral routine. If you don't know how to do that, I made a video on that, and I'll be adding the link. The link will be in the description box. Create an oral routine for yourself. Number two, rinse your mouth after using inhalers. This is especially for the people who make use of inhalers containing corticosteroids. Make sure you rinse your mouth so that you will wash away the residues of these corticosteroids that might be hanging around your mouth or sitting on the surface of your teeth. Number three, manage blood sugar if you are diabetic. Yeah, diabetes is one of the causes. I forgot to mention that in the video. Diabetes is one of the causes of oral thrush. So if you are diabetic, you might need to manage your sugar. You might need to control your sugar intake and stay on diet. That would help as well. That's a way of preventing yourself as well. And if you are not diabetic, just make sure that you cut down your carbs, reduce your sugar intake to avoid finding yourself in this kind of situation, as it is said that prevention is better and of course cheaper than cure. The last point on my list on how to prevent oral thrush is to visit your dentist regularly, at least twice in a year. It is advised that you visit your dentist regularly, especially twice in a year. I hope that you have gotten value from this video, and I hope that I have answered your questions on oral thrush. If you have gotten value from this video, kindly like this video, comment, and of course share with the people who will be needing this information. Also, don't forget to subscribe to this YouTube channel. If you are seeing me for the first time, turn on your post notification bell so you can get notified anytime I post a new video. And if you are a returning subscriber, thank you so much for always coming back to feast on my content. Until I see you in my next video, take care of yourself. Bye bye.